Started your 2 minutes time.
Yes, ma'am. Next slide. First slide.
Started your 10 minutes time.
Hello, I'm Dr. Geeta, one of the doctors at Essential Clinic today. May I confirm your name and age, please?
Yeah, I'm Mrs. Bola Adigola and I'm 33-year-old.
How would you like to be called?
Yeah, Bola is fine.
Ambula, I believe that you have been referred by your GP as you are 36 weeks pregnant and you are here to discuss about your mode of delivery options. Is that right?
Oh, yes.
Mhm. Any other concerns or expectations from today's consultation? Ambula?
No, I just wanted to know my options.
Okay, surely. So, Bola, I just want to ask you a few questions to know more about your pregnancy so that I can better explain to you about your options. How this sounds to you?
Oh, yeah.
Mhm. So, could you tell me about your pregnancy so far?
I didn't get you, doctor. What you wanted to say?
Yeah, could you tell me about your pregnancy so far?
Yeah, my pregnancy is absolutely low risk. This is my planned pregnancy. Pretty normal. All reports, all my scan, everything is normal, doctor, up till now.
Okay, that's good. Uh, Currently, any complaint like pain, bleeding, anything?
No, doctor, no.
Have you named your
No, no,
hello?
nothing. No, no.
Your baby?
Yes, doctor?
Have you named your baby?
No, no, no. I don't. I haven't named it.
Okay, so how your baby is doing? Moving?
My baby is quite well, doctor, but I'm just worried that my baby might be little on a higher weight.
Okay, so I will give you your scan report with your permission later on. Okay, or have you told anything about your weight of the baby?
No, I have not done a scan.
Okay, so we will go through for that. I will examine you. Okay, so
Okay.
I gathered, Mrs. Kula, I gathered from your notes that in the previous pregnancy you have got a T-year. So could you please tell me about your that pregnancy in detail?
Yeah, doctor, actually, my pregnancy was absolutely low risk pregnancy, but I crossed my due date and they waited for 10 days. And then they decided to induce me. I do remember that I had been in labor for a prolonged time, but then they said no, I was in labor for 10 to 12 hours only. They induced me with three propays, and after that, I went into labor. It was a prolonged labor, exhausting labor, and then they had offered me this epidural also. by the end of the labor, and my baby was 3.5 kilogram. And after the delivery, I just remember vaguely that they mentioned that there is some tear and I need to go to the theater, and they took me to the theater, and then they sutured it. That's it, and they explained me why this has happened actually.
So sorry to hear that you have gone through a lot. Yeah. So whether any instrument was used at the time of delivery,
No, no, it was a normal delivery.
and how your baby is doing?
My baby is fine.
And did anybody discuss with you about the detail of the tier, what type of tier, and
Yeah,
how
they
can
had mentioned, but then I just I'm really scared and I'm really anxious that this might happen with me again, and I may have to go through the similar situation. So I am just here to discuss my options, doctor.
I can see that you are really anxious, Bola, but we try our best to address all your concerns in the short. Okay. Yeah. So currently, do you have any complaints like any leakage episodes, leakage of food?
No, I am not having any episodes. I will never actually. After that treatment, only I was getting a good control.
Okay? Any difficulty in control when?
No, no, no.
And your recovery was fine at that time, right, Bola?
Yes, my recovery was fine after that.
Any medical condition for that you're following your GP?
No,
Any previous surgeries beside that fear?
no,
Allergy to anything?
no.
And did anybody discuss with you regarding the perineal massages, or are you doing that?
No, doctor, I just wanted to know what actually exactly it is.
Yeah, I will explain you soon. But whether did anybody discuss with you about the options of the delivery at that time after the 3 year and the follow up?
Now I am here to discuss, doctor.
And what about your blood group,
It's O positive,
body weight height ratio,
normal.
and reservations for transfusion if required?
No,
Allergy to anything?
no.
How's the support overall at home?
Oh, yeah, I'm very well supported.
That's good. Thank you for sharing all the information. Coming over your concerns that regarding the options. Mrs. Bola, you're right. Uh, your concerns are very much right. There is a small chance that women can have a tear after the those who are having the tear. But that is very less. That is 7 to 10 out of the 100 can have a tear. But you can see that 90 out of the 100 women can have a straightforward delivery. Okay.
Okay.
So, yeah, as the good thing is that you don't have any symptoms at this time, like any bowel symptoms. So we have got the two options. Either is to go for the vaginal delivery as you don't have any symptoms, or to go for the cesarean section. And can I discuss with you the detail about the options?
Oh, yeah.
Yeah. Yeah. In the vaginal delivery, the good thing is that it will be straightforward. Uh, Early recovery, short hospital stay, early initiation of the breastfeeding, and on the other side, there is a small risk of the TBR, that is about 7 to 10 out of the 100. On the in the cesarean section, the benefit is that no any risk of the TBR, so no any fear. But on the other side, there's a risk of the anesthesia, risk of the clots with the surgery, long hospital stay, and requiring the cesarean section, the future pregnancies. So these could be the risk with the cesarean section. Okay, am I clear up to this point, Paula?
Okay.
Do you have any particular preferences?
No, doctor, I'm just worried about that tear and I don't want to have that tear. And that's the reason I wanted to know my options.
Yeah, for that we can take certain measures to reduce the tear, like your delivery will be at the consultant-led unit, where throughout the labor you will be seen by that experienced person. We can offer you the perineal massages that you can do just now from 35 to 36 weeks. You can do that. For that, my nurse and me we will guide you how to do that massages 2 to 3 minutes at least one time 2 to 3 times the massage for at least 3 times a day. That may help you. And also at the time of delivery, when we can just give a warm compressions at the time of delivery, or a good support at the time of delivery of the head of the baby, so that's to minimize the risk of the tear. Am I clear up to this point?
Okay.
Anything else that particular you want to know?
Yes, doctor, actually, you told me. So, if there are measures to minimize this tear, any other
Yeah,
particular measures, something like cut, you can give me so that the tear will not be there.
yeah, you are right. We give deliberately a cut down below to deliver to facilitate or to deliver the head of the baby, but there's no evidence that it prevents the risk of the tear. Okay, and we cannot predict that which woman can have a tear. Okay, am I clear, Bola?
Okay. And to avoid it completely, would you recommend cesarean section, doctor?
Uh, According to the evidence or the research, when the women do not have any symptoms, in that case, we generally offer the vaginal birth. But in the end, decision will be yours. We will support you in your decision. I will give you the detailed information, whatever I have discussed is about the parental tier and the options. You can also go through that as well. Okay.
Okay, okay. Yeah.
Yeah. After delivery, baby will be seen by the baby doctors required. We will support you uh, in the breastfeeding. We will also put you in contact with the contraception clinic. I'm giving you the written information. You can go through this, and I'm also documenting whatever I have discussed here. Anything else that I can help you, Bola?
No, doctor, thank you. Thank you, doctor.
How much time is remaining?
Completed well in time. You couldn't, means I could not able to hear you, your last sentences. Maybe because of loose internet connection. Okay. That closing sentences I was not able to hear. So if you want to say something regarding closing this task, you can say so now.
I said in the end that I will provide you the information regarding the perineal tier and the options. I will do the documentation, whatever I have discussed here. Will write back to your GP uh, and make an arrangement with my consultant. Anything else that that you want to help you?
No,
I,
thank you, doctor. Thank you. Okay. Dr. Geeta, your own reflection. Then we will go through my feedback and then very good. Okay. Well done task.
I thought that I was not organized as I must be.
Yeah, you need to organize yourself so that goes systematically. But still a good task. Anybody, anything else you wanted to comment? Anybody has picked up any mistakes? I will be happy if some volunteer will come up and say, okay, this was missed, or this is good, this is good. It's actually a multi-way process. If she is discussing, I am discussing, it is two-way. But you all are listening, at least keep your ear open so that you can also find out and take a part in this interaction. Anybody?
Hi, ma'am. Hi, ma'am.
Hmm?
Uh, I'm Madiha. Yes, overall, she did very well. Only few things. In the end, I'm feeling that to mention the patient regarding the red flag sign, like any problem, like feeling baby movement is low or any bleeding
Yeah,
and any
any
yeah, then
because
yeah,
now she is nearing 36 weeks. No, she is. So at 36
yeah.
weeks, she can be explained and she can be given her details and she can come contact back. Yes, agreed.
And one thing that I'm feeling that during the history taking that you were mentioning that my baby weight is on higher side.
She took it very wrongly.
So
So
that's how,
yeah,
yeah,
even I
till
had
then that
mentioned,
I'm
even I
feeling.
had mentioned that. I have commented about that. Very nicely identified, doctor. Very nicely identified. When I had mentioned, no, this time I'm just having a concern that my baby weight is little on a higher side. So this is my hidden concern. Okay. Okay. So if it is so, then I will be arranging a ultrasonography nearing 37 to 38 weeks of gestation. Not now. I am 36 weeks now. Okay. And depending upon that, if the baby will be very big, then again we may reconsider the option. Okay. But as of now, even big babies, they can be allowed to go in labor, or they might offer her induction of labor if it is LGA babies. Okay. And if it is normal, then, but arranging ultrasonography was a clue here. She asked me, I will go through your ultrasonography, or I will examine you. Arranging ultrasonography was the answer actually. Very nicely identified. Anything else? Anybody has picked up anything? Okay. Okay. So now my feedback, introduction, aim, setting agenda, pregnancy details were very well. Mm, quite relevant history, but still she took time of 5 minutes 30 seconds because she was not organized. She was maybe somewhere somehow she was repeating the questions, and she has asked me some question regarding perineal massage. Okay, so this is your idea. Okay, now you have to explain me what I need to do to go ahead further. That is OSC care bundle plan. You have to give me, Dr. Geeta, if not been explained. Okay, not been explained, but too much stress on those points. You took almost 5 minutes 30 seconds to elicit the similar those history, what is relevant and which could have been finished within 3 minutes 30 seconds. Very simple and simple task, a straightforward task. This kind of similar task has come in November, I think, and that time the age of the patient was 41 year, and there was a CF carrier, and the patient was CF carrier. Okay, here it was a straight station, nothing was given here, everything was a straight station. No, not this one, the previous task actually had similar station, but this kind of task has come up many times. Okay, many times. uh, and this is similar to the Lisa task what I had discussed previously with previous group. Okay, or might be you people, I do not remember as of now, but yes, this is the similar to on that context only. uh, Perineal massage, do not emphasize, just make your history taking template so crystal clear that you will able to finish your history taking in 3 minutes 30 seconds. If you asked me, my points will be very crystal clear in this task. Introduction, setting, introduction, situational area awareness, because here the GP has mentioned that my aim means I will be introducing myself. I will be saying that the midwife has asked me to see you, because there is a GP letter stating that you wanted to discuss about birthing options. Okay, you wanted to discuss about birthing options as you had a bad nasty tear in your previous pregnancy. Am I right? Yes. So can I ask you a few questions? Yes. Um, can you just tell me in detail about your current pregnancy? How is your fetal? How is your baby's movement? Have you named the baby? Any concern regarding this pregnancy? No. Booking blood test and everything is perfectly fine. Yes. The next question regarding my previous pregnancy, I gave you a very detailed history that could have been the point where the time might have been taken, but that the detailed history I needed to tell you. Okay. Yeah. Oh, I'm really sorry to hear that. How was your recovery? Any symptoms while controlling your bowel or means flatus? Any bladder symptoms? Because it is a traumatic delivery. Any bladder symptoms? And how about your baby? Baby is fine. Then the rest of the histories, I would like to access your case detail. The next question should have come to your mind is accessing your case details. Quickly then just took her through a medical history, surgical history. You can skip in this task a smoking and alcohol history, because see, in antenatal care, if the patient is registered with midwife and with the GP for this long, many a times they will not be having any smoking history or alcohol history. But still, if you are really scared enough, I will ask here only smoking history. I will skip upon alcohol history. Okay, I will not ask about support or occupation also here. Yes, BMI is very important point because the chances of having a repeat problem we needed to know. So BMI, blood group history I will not ask. I will not ask JOA history also if I think that I am having a less time, because anticipation of requirement of blood group and JOA. Okay, so less likely. But still blood group you can ask thinking one possibility that it might be a negative blood group. Okay, so still I will give it to that. Very nicely means you had avoided examination. I will definitely give you really star point for that, because here I had come to discuss my options, so no need to examine me at this point, but you offered me examination when I told you about birth weight. Then concerns you had explained me tear. Okay, but Dr. Geeta, in spite of me having a tear, you need to check my understanding what I know about the tear. Did someone debrief you? And then you just need to give me some brief idea about yes, a 4-degree perineal tear, and then you need to tell me the risk associated with this 4-degree perineal tear, because it is a repeat risk of having a similar kind of tear, that is 5 to 7 out of 100, and it is not 7 to 10 out of 100. Am I right? Anybody?
Yes, ma'am, 5 to 7.
Yeah,
Yes.
you mentioned
Yeah,
about
it is
7 to
5 to
10.
7 in 100.
Yeah,
Yeah.
you mentioned about 7 to 10. So, no wrong. Whatever PIL numbers not here,
Okay, it is about
those
7. All
numbers
right.
are very important. Those numbers are very important. Do not misinterpret those numbers. Start writing it down on a diary from now onwards so that you will not miss it out.
Definitely.
Uh, yeah. Then you need to explain me regarding the third and fourth. What is 4-degree perineal tear? You just need to tell me, explain me. Yes, in your case, it was suture completely, and now you are asymptomatic. You are not having. That means the risk of, oh, yeah, but still there is a risk of having a repeat 4-degree perineal tear, and the risk of having a 4-degree perineal tear, prolonged labor, second stage of labor, big baby, and instrumental delivery. Uh, as of now it seems to be a low risk pregnancy, so we can have both the options, and you can choose whatever suits you. Okay, you mentioned that that is autonomy, patient's autonomy you mentioned, and you explained me regarding the pros and cons about the option, and then you had given me a plan, and you had ended it. But this is a task where you have to give me a more positive emphasis on vaginal birth. Okay, so somewhere I thought that you were doing a non-directional counseling, but still some positive emphasis on vaginal delivery. Some positive emphasis on vaginal delivery, because it's a more natural way, the least complicated way, and there are ways to prevent the complications. You had mentioned few complication risk, or you had mentioned few interventions to minimize the complication, but it would I would have means I wanted it in more convincing way, so that convincing power was not there, that was missing somewhere. That is my assumption, Dr. Geeta. Okay, so see to it, you will, yeah, you will try to communicate in a way so that you will sound more convincing. Okay.
Yes,
And then, yeah, then you, because you were having less time, so you rushed last few seconds and you finished up the task. Hmm? So that is my observation. Anybody wanted to have any other comment? They are open for their feedback, and then we can go through the answer key discussion. Anybody wanted to,
Uh,
means yes, yes, doctor.
I want to say one thing, like when we are talking about finally giving the uh, delivery plan, can we say like this that uh, let me inform you, Bola, that 60 to 80 out of 100 women who have had vaginal tear in the previous day, like third, fourth degree vaginal tear in the previous pregnancy, having no symptoms, can go for vaginal delivery. But I want to tell you that 5 to 7 out of such 100 women can have the tear once again.
Actually, you wanted to say that 60 to 80% of this woman who had this tear will be asymptomatic, uh, and they will not experience any symptoms of this tear. And But
Yeah, they will.
yeah,
Uh-huh.
you can say this
Mm-hmm.
sentence, there is no harm, but in this context, I haven't used that symptoms. This is very important when that patient
Mm-hmm.
of OSS come to you with the symptoms in early days.
Mm-hmm.
Okay. So that sentence will be
Okay.
very reassuring when the patient is having symptoms in early time, before 6 weeks.
Mm-hmm.
Okay, so that
Mm-hmm.
is one sentence which you can use
Okay.
at that time, but here it is not having any context because the patient is asymptomatic. That is why I have not used
Mm-hmm.
it. Okay, my way. But if you are
Okay.
definitely having a time, you are able to manage your time and you know that I can have a more positive, so you can use that sentence. I'm not saying or I am not denying that no, you should not use that
Mm-hmm.
sentence. You can use, but since the patient
Okay.
was asymptomatic, she had come with the second pregnancy, I am not using it here. Okay, I
Okay.
am not using it here, but
Mm-hmm.
yes, I will be saying yes. The tear what you had, the chances of tear delivering for the first time is 6 in 100 women. And if the woman is
Yeah, the for the
delivering,
priming.
yeah,
Yeah.
yeah, primary. And if the woman is delivering for the second time, or the if the woman is delivering with the previous year, then the chances are 5 to 7 out of 100. Those are similar, but then there are ways to minimize those. So my emphasis here will be, but then there are ways to minimize this kind of tear. Hmm? Definitely, we will keep a watch on your baby's weight because that is one important factor, and we will monitor your labor progress and we will decide accordingly. Okay, as of now, since no symptoms, so cesarean section is not recommended. That's the reason even I had not mentioned about, means I will go through the answer key, that ultrasonography and manometry. Okay, rectal manometry or pressure changes. So that also will not be included in this answer key because she is asymptomatic. So in her case, the cesarean section is not recommended since she is asymptomatic. That is one point which you have to mention. But she is still having a autonomy to decide what suits her better. The option for her will be vaginal delivery and cesarean section, both are open. Now coming to the convincing way, yes, so my way, I wanted to know whether cesarean section is recommended in my case. No, since I'm really sorry to say this, but cesarean section is not recommended in your case as your symptoms are not there. I just wanted to tell you, yes, it's a surgery. It's having its own positive things. That means you can plan your date, you can plan your time. Surgery at 39 weeks of gestation, quick option. Okay, quick option, but the recovery will be lengthy. It's a surgery, risk of injury, risk of bleeding, risk of means delayed bonding with your baby, means some concern with the baby like asthma. So those are the risks which are concerned. And if future thing you wanted to say that, then there are risk of having adherent placenta, repeat cesarean section, risk of rupture. So all these risks make it a high risk option for a mode of delivery. So this makes her a high risk patient when it comes to cesarean section. On the other hand, there is a vaginal delivery. In her case, the chances of having a spontaneous natural delivery is very high, which is a more natural way of delivering, so that she can bond with her baby early, so that she can be discharged early and she can recover also early with vaginal delivery. But yes, we do acknowledge that there is a risk of this repeat third and fourth degree tear, and where we are having certain measures to minimize those tears. Would you like to listen to that? Yes. So now onward, we will be advising you to do a perineal massage with the help of some olive oil, some coconut oil. You can take a help of your partner here and ask him to massage your perineum. Okay. Secondly, during labor, she will be given a warm compression once she will be fully dilated. Adequate protection of perineum will be offered to her by midwife, assisting midwife, and if need arises, although a episiotomy or cut will not minimizes the risk of perineal tear, but will be considered in her case to avoid a repeat trauma to her perineum or her third degree or fourth degree perineal tear. So these are the measures, and we call it as a OSC care bundle plan. So these are the measures which will be taken in her case to minimize these options. And if she will be symptomatic, by sonographic defect in the muscles of the anus and in the pressure manometry. Okay, so this way I will be counseling. So this is a more positive way of counseling, what I feel. You got my point, Dr. Farah? Fakar, Fakeha.
Yeah, that's right. So, like we will mention episiotomy here, like we can consider, or
Yes.
when the patient
What is
asks, then we
OAC?
will say,
Yes. What is OAC care bundle plan?
yeah,
She
these
had
are
a,
the points which we, yeah.
yeah. So what is OAC care bundle plan? So that is my star point here. How you are going to minimize my risk of minimizing the tear? How you are going to? So that is a, the sentence is definitely that the episiotomy will not give me a protection, but it will be considered in my case to minimize or to prevent a further damage. So that is one thing which you have to mention here, that OAC care bundle plan, and that is another leaflet which you can share with me along with a cesarean section leaflet. Okay, so can we go through the answer key quickly,
Ma'am, should
Ma'am,
we ask
I have one
about
question.
future
one by one?
fertility?
Yes, future fertility, she missed out on future fertility. Yes, one important question she missed out. Okay, the next person who wanted to say something.
Yeah, ma'am. Actually, in the past recalls, I saw one a question in that there was a patient. She was symptomatic. She have a perineal tear. I don't know, third or fourth degree tear. But after that, she was symptomatic for up to the 6 months. But after six
Six
months,
weeks.
her symptoms
Six
reduced.
weeks. 6 weeks. She was symptomatic till 6 weeks.
And that it was written about up to 6 months. Then after the 6 months, she was fine.
Okay,
So
after
in
the
that
six
case,
months, she was fine. Okay, so as of now, she is asymptomatic. So here you can use that sentence, what Dr. Fareka has said, na, that yes, 6 to 8 women will be asymptomatic by the end of 1 year. What we have seen. So she is amongst that 6 to 8 women, and if she will be asymptomatic, in that case only she will be offered ultrasonography to see the defect size and the pressure changes to see whether there are any defect in the means decreased pressure. And if it is so, then in that case cesarean section is recommended. If this patient is at 6 months, she is symptomatic. Okay, so it is the small changes will change your answer key in a different way.
we will offer her scan now, although she's not symptomatic, but she
Now in
has
this
the
case
symptom of
no,
the
in this
pregnancy.
case no, in this case no, because she is not symptomatic. So in this case no, but the patient who will be symptomatic by 6 or 8 months after the repair, here you can max to max, you can just say to be on a safer side, if there would have been a symptoms, we would have offered you this. Okay, but in this case I have not mentioned it actually. I have not mentioned it. Okay. So, going to the answer key, introduction, situational awareness, 4 degree tear, GP letter, gathered information, which we had discussed. Okay, the history was, we had discussed in my discussion. This was the only history. How far is your pregnancy? 34 or 36, something like that. How is your pregnancy? Low risk, high risk. Fetal movement, named baby, you if you want to connect with the baby, previous detail, accessing case details. Okay, is very important question which you had missed out. Any residual bowel or bladder symptoms? Detailed questions regarding the leak or flatus leak. Fit and healthy, supported, smoking and drinking can be skipped if you think that your history taking is not. No need to ask your mental history, trauma was in the past event. Okay, what are your views regarding laboring options? Here my another question is, what are my ways? Okay, what are my views regarding laboring option? Examination is not here, not needed, do not offered. Okay, so information gathered from GP letter that you had experienced a 4 degree perineal tear. Do you wish me to explain you regarding 4 degree perineal tear? And most of the time that is there in their answer key. Yes, I wanted to know. Okay, so if it is there, please explain her with the help of drawing. Perineum is a area between the vagina and the back passage. It's common to have a some sort of tear during labor, and that is 9 to 10 out of women will experience some sort of superficial or skin deep tear. But 6 out of 100 women who are delivering for the first time will have a risk of this obstetric anal sphincter injury, that is known as OSIS. Have you heard about this terminology? No. The risk factor is, in your case, prolonged labor and big baby.
4-degree tear involves the skin, perineum, muscles of the perineum and extends deep to the muscles of the anal control and the lining of the anals or the rectum. So you just draw what exactly it involves. This will take not more than 30 or 40 seconds. So this is a disturbed anatomy or disturbed this if this tear will be happening, this there will be loss of control over your bowel function, and to restore it back it need to be suture under all aseptic precautions in the theater, which was done in your case. And the best part in your case is now you are asymptomatic. Now you are asymptomatic, but having a 3rd or 4th degree perineal tear in previous pregnancies increases your future risk of having similar kind of tear in the next pregnancy, and that risk is 5 to 7 out of 100. To avoid it completely, the option will be having a cesarean section at 39 weeks of gestation. Please mention whenever you are going to say cesarean section, at what gestation you are going to have. It will prevent it completely, but it's a surgery and the risk of anesthesia will be there. Bleeding, injury, infection, future chance of repeat cesarean section. Not a natural method of labor. Subsequent pregnancy increases repeat risk of cesarean section. Scar might give way. Risk of adherent placenta makes these pregnancies very high risk. Okay. So any future desire of having a big family or more babies, you can ask it here also if you think you have skipped this question previously. Along with this, it will delay your recovery and bonding with newborn. Some concern with babies with C-section are that they are prone for obesity and asthma in childhood. On the other hand, labor is a natural process. It started on its own, and if it started on its own, there is a good chances that the baby will be delivered early and smooth. Especially here, in your case, we may have to offer you a consultant led care booking because the risk of damage to the perineum. That's the reason I had mentioned. Although tear to back passage can't be predicted or prevented, but certain measures will be taken to reduce the risk, like perineal massage and physiotherapy or pelvic floor muscle exercises from 34 weeks onward. It can be done by self or partner. Take permission to explain and offer her explanation if she wanted. OSC care bundle plan, which includes hands-on technique of birth and protecting perineum by experienced midwife. Episiotomy or cut will be considered, but episiotomy should never be routine intervention to reduce the risk of OSC. That is my sentence, okay? And should only be carried out after clinical assessment of fetal and maternal risk through examination, as an evidence suggests, as no evidence suggests it it is to be used prophylactically. USG at 38 weeks of size, because she has mentioned it's a big baby. But normal labor is a reasonable option in her case, as she is not having any residual bowel symptoms and there is a low chance of needing instrumental delivery, as she is absolutely low risk in this pregnancy. Okay. So, although you have done a non-judgmental or bidirectional counseling, still you have to give her, you have to make her more eligible or more, you have to make, you do not have to make a decision for her, but you have to encourage her to take a safer decision for her. Okay, you have to respect her autonomy, but at the same time you have to certain that she will take a wiser decision. Support the choice made by woman. Give her time to decide. PIL of, these are my PIL: perineal tears during childbirth, what you need to know during pregnancy. OSC care bundle information for expectant mothers. Care of 3rd and 4th degree perineal tear that occurred in childhood. So this last thing you can skip it, but these two patient information leaflet you need to give. Then support groups are MASIC is one support group. At least one support group you need to know. Birth Trauma Association. Documentation, 24-hour care plan. Whenever there will be having any bleeding, leaking, any concern with fetal movement, you need to follow up. Right back to the GP. Next, a follow-up appointment with the consultant to discuss it in detail. Okay.
Can you please tell the name of the support group once again, please?
RCOG Perineal Tear Hub, Mother and Anal Sphincter Injuries in Childhood, Birth Trauma Association, and Bladder Bowel Community is a common community whosoever is having any bladder or bowel symptoms. So here it will not be a it will not be a relevant support group, but this MASIC, Birth Trauma Association important, okay, and Perineal Tear Hub. These three. counseling a patient with that their preferred mode of delivery, objective, non-directional manner. This is communication with patient. Okay. Uh, the competent candidate will listen to the concerns and explain what the woman's options are in a clear and plain language. Allow her to make an informed choice and how she would like to have this baby in an unbiased way. Woman should be able to use the information to make her own choices rather than told what to do. Okay, so that was not happening in your case, Dr. Geeta, and that's the reason I said that you are having a good communication skill. You need to know how to counsel and how to negotiate. Negotiation and compromise are a key skill being tested. Practice agreeing a plan rather than deciding for patient. You do not need to decide, but allow her to take a wiser decision. Demonstrate understanding of the anxieties of the patient. Discuss pros and cons of vaginal and cesarean section. Unbiased counseling using evidence. There is no evidence for not allowing women to like her or undergo either a vaginal or cesarean section. So she can choose whatever she's wanted, but negotiation. Reassurance. Okay, so communication with colleague is review, discuss referral to expert for review if she needs more reassurance, and plan of care. Involve consultant in counseling, decision on management. Basically, this can be done at your level, but if she is not satisfied at the end, you just need to tell her that the next appointment will be with the consultant. Skilled midwife in planned intrapartum care. Applied clinical knowledge is compromise, reassurance, and negotiation. Important thing, so that woman in order to build her confidence. Risk factor do not allow to accurately predict oasis. This has to be mentioned. Ultrasonography, if she thinks that the baby is big. No evidence that episiotomy offers protection, which you had mentioned. Warm compression you had mentioned. Perineal protection you had mentioned. Vaginal delivery is a very reasonable option as she is not having any residual. So this you have to emphasize, which you couldn't able to emphasize this sentence. Fear and misconception may be allayed. However, competent candidate will able to account her wishes for future children. This is also very important, dear. Okay, and that will be allowing us to take a decision which suits better for the patient. This is again patient safety. That is that no evidence to suggest use of prophylactic episiotomy, but that is included in OAC care bundle plan. uh, Identity, empathy ensure woman feels she's taking the choices, she's making the choices, not you will be making the choices. Empower woman to make a choices. Respect autonomy, that means acknowledge patient's right to choose a mode of delivery. So you were allowing me to discuss. Okay, so that was not a problem. Discuss the risk of CS versus vaginal delivery. They will explain risk of repeat cesarean section clearly and objectively, including intraoperative risks such as bowel bladder. You mentioned this. You had mentioned pros and cons of both the options. Woman has all information she needs to make an informed choice. Finally, obtain details from the previous hospital, which you had missed here. Actually, this has been missed. Information gathering was quite relevant. I will say here, obtain information about asymptomatic tear. Delivery record which you missed out, experienced with the previous delivery, be able to appreciate concerns of the patient and doubts about mode of delivery. Um, okay, so the history information, I mean, information gathering was quite relevant. It is also important to ascertain her current symptoms, her preferred method of delivery, and the reason behind it, including her long-term plans for further children. This question was missed out. Okay, so this is what about a repeat, no, a previous 4-degree perineal tear. Anybody is having any question regarding this? No?
No, ma'am. Clear.